Alright, well that sounds like pretty good people in your life that could help you to achieve ultimately what you're trying to, which would be abstinence. But are there any things that you feel might be hindering you from being able to quit using these substances?
My back pain.
Okay, well, do you feel that maybe if you did like what I suggested, maybe going to physical therapy and maybe using more Tylenol and Advil and, seeing if you could get, some time off work, what do you feel that could help you?
I don't know. I can try.
Okay, well, that's all I can expect from my patients, and there will be times when the patients do make mistakes. I have seen, I don't know how many of my patients relapse, and they come to me all upset and feeling like they failed. I'm just like, it's okay. Don't worry about it. It happens. Just forget about it. Move on. Try again. It's just a lot of the patients just have trouble, starting over again because they feel like they failed once. How could they possibly do it again? But you just have to keep trying to just stay abstinent, no matter how hard it may be, because ultimately, I feel if people try hard enough, eventually they'll be able to stay abstinent.
I don't know.
Well, thank you again for meeting with me today, and I forgot to say this at the beginning. I usually do for most of my patients, but I am not in any way trying to tell you what to do. The patient ultimately makes the decision for therapy about what they want to do, what they feel they should do. And I just want you to understand that, because a lot of times the therapists, they try to act like they're superior to their clients, and that's why you notice I'm not trying to pretend that I'm superior to you or anything like that. I'm just trying to, do the best I can to help you, and I just hope that you see me ultimately as someone you can, come to when you need to talk about things, maybe someone that can help you if something comes up, and if you just need somebody to talk to about that, you just come to me. That's kind of a role that as a social worker I would like to kind of have. Now ultimately each patient chooses how much they want to come to therapy. Some come every week, some come every month. How often would you like to come?
Probably about every 2 weeks.
Okay, that sounds good for right now. Sounds reasonable. And eventually, maybe you'll be able to work your way up to where you won't have to come every 2 weeks after a while. And maybe if you do really good, you might get to the point you don't have to come at all. You may not have to come here your whole life like some patients do. Some patients do really well with therapy. Some don't do really well. It just depends entirely from individual patient to individual patients. So, okay. So what would, your goals be for the next time I meet with you? What would you like to have accomplished?
Hopefully by then I'll cut down the pills a little bit.
Okay. That sounds like a pretty reasonable goal. Okay. Do you have a specific amount that you would like to cut back on, or are you just kind of waiting to see, not really sure yet?
About at least start out with